My name is Abby and I'm the registered nurse who will be handing over patient Jason Bilkos tonight. Mr. Bilkos is an 82-year-old male, born the 1st of the 1st, 1937, MRN number 123456. He was brought in by ambulance today, the 13th of the 9th, 2018, to the emergency department at 1600 hours with chest pain and shortness of breath. Ambulance officers handed him over, saturating at 82% on room air and with a respiratory rate of 32 breaths per minute. Since arriving, the patient has denied any further chest pain. Mr. Bilko has had many prior hospital admissions as a result of unstable angina and more recently has suffered from multiple falls. At 16:20 hours, I performed an A to E assessment and a set of baseline observations on Mr. Bilko, where I documented his heart rate as 101 beats per minute, his oxygen saturation at 88%, blood pressure was 138/72, he had a temperature of 36.8 and his respiratory rate was 28 breaths per minute. At this stage, I was concerned with Mr. Bilko's worsening condition, so after placing him on 6 litres oxygen via Hudson mask, I called for a clinical review. His GCS was 15 and he was alert and orientated. I then performed an ECG on the patient and attached him to the cardiac monitor where he was monitoring in sinus rhythm. I gave the results of the ECG to the doctor looking after him, Dr. Lance, where he confirmed there was no abnormalities. Dr. Lance then ordered a chest X-ray for Mr. Bilko, inserted a cannula, which I checked and is patent and working fine, and took some bloods, which were sent to pathology. 1 litre of 0.9% sodium chloride was ordered by the doctor to be given over 10 hours, which I commenced at 1700 hours. Mr. Bilko's chest X-ray results returned after this with a diagnosis of mild pulmonary edema. He was then admitted under Dr. Turner's team for any further care. Dr. Turner ordered a stat dose of 40 milligrams intravenous furosemide for Mr. Bilkos, which I administered at 1800 hours. I performed another set of observations on Mr. Bilko just after 1800 hours and just after I administered the furosemide. Mr. Bilko's condition had dramatically declined with his respiratory rate above 30. He was saturating at 84% even though he was still on 6 litres oxygen via Hudson mask. His blood pressure was hypertensive at 180/95. His heart rate was 125 beats per minute and temperature had dropped to 35.5. His GCS also dropped and he is now only rousable by pain. With Mr. Bilko's worsening condition and more than 2 of his observations falling in the red zone on the SAGO chart, I felt it was necessary to call a Met call. The Met team is currently with Mr. Bilkos and we are just waiting for more information on his condition and any further instructions on his care plan. In the meantime, if you could please contact Dr. Turner in regards to seizing the patient's fluids. Due to his recent diagnosis of mild pulmonary edema, I don't think they are necessary. As well as this, I would recommend that the patient is put on a high falls risk after his recent history of multiple falls, along with ongoing observations and close monitoring. All observations have been charted, medications are up to date, falls risk assessment completed, and all details on today's events have been documented as they happened in Mr. Bilko's progress notes, so please refer to those if necessary.